Now, on this picture, I show this, I have made this showing the same thing with the pacemaker here. I want you to follow my arrow. This is the cardiac pacemaker, and these are the wires known as the electrodes that leads into the heart of the said patient. On here you will see me making certain notations addressing law enforcement. Do the cops know I have a medical condition? Yes, my skin is black. See a man's face, but you don't see his heart. Do they really know that they could have asked certain questions to protect an individual wearing a cardiac pacemaker before they apply a taser? Now, I want to share something with you now. Listen and listen good. I would not have been doing this had I not seen it vitally important that you all know these things. I am sharing what I've learned over the years in the medical arena, in the medical profession, sharing it with you all so that you will know. There are several things I had been a witness to in the Trenchtown ghettos of Kingston, Jamaica, when problems, trauma would affect or be inflicted on certain individuals. I have seen people have heart attacks, cardiac arrests. And do you know what the people usually do? They just crowd around the individual, looking down on the individual as the individual is dying, with no one having the knowledge and the skill to perform CPR, cardiopulmonary resuscitation. Not even an AED, an automatic electrical defibrillator, anywhere around. Not even have a phone to call for any help. Yes, in the Trenchtown ghettos, I have seen my brothers and sisters die. And that's why Vincent Tarterford wrote the song, No Woman No Cry. Yes, which Bob Marley did put into music and sent to the world. It was written by Vincent Tarterford, No Woman No Cry. I was there along with the other brethren and sisterins and family, observing many things. It is my hope that in the United States, Jamaica, and the rest of the world, that government take the necessary steps to provide every city, town, village with CPR training, AED instruments, and with at least one or two individuals in every city, town, or village who know the way to perform cardiac resuscitation, even on infants and adults. It is my wish and my hope that that becomes routine, especially in the ghettos, and especially in the ghettos of our poor black people. I have seen many things, and I can tell you this. Working in a hospital in any city, town, or village, that's when you get to know the city, town, or village. Because people are born there, people come there while they are sick, and people die there. And if you have worked there in the system, you get to know the system. You get to meet the people who are citizens of the area, of the city, the town, the county, the village. That has been my life's works. And I'm sharing this with you all. I want you to tell the people whom you got it from, who shared this with you, and tell them to pass it on while telling others from whom they got it and whom it was shared from. I am Ras Cardo, and I'm sharing this with you all so that you can share it with others to save the lives of people. And I ask of you, share because you care. So my people, I was the original whaler who went to school to study in saving the lives of people. I have instructed many nurses, doctors, nurses' aides, nursing attendants, medical doctors, emergency room doctors, work with many specialties over the years. I'm now telling you this, my record speaks for itself, and it speaks volumes. There was a time I was a radiological expert advising people from all over the world about their radiological x-ray situations and interpreting their radiological findings for them. For when they would get their report from radiologists, many of them would not understand what the radiologists were talking about. So I helped them to understand. Share this with others, and hopefully someday we will hope that America will put into law the public health law, saving the lives of the people law. A simple question. For those who are wearing medical life-saving devices under their clothes, under their skins, that it will be a requirement that law enforcement will inquire of them if they got a medical condition that they should be aware of. I am Ras Cardo. I'm here for a healing of the nation. I'm here to teach you what I've learned, as I've done in the ghettos of Trenchtown, Kingston, Jamaica. You will not see this anywhere else or get it anywhere else. Rastafari, I know.